project on Suicide Squad. The table of contents. So first we're going to have our description. The description. The name of the movie. The character we're looking at is Dr. Harleen Quinzel. The movie is Suicide Squad, and she's a doctor gone mad out of love for another and takes on the part of Harley Quinn. Her background. Harley Quinn was originally Dr. Harleen Quinzel. While treating the Joker, she became fascinated with him. The Joker manipulated her emotionally and psychologically, leading her to fall in love with him. She helped him escape and descended into madness herself, becoming Harley Quinn, his partner in crime and lover. The film's culture shows the cultural anxieties that are based on trauma, mental illnesses, and identity. Next is diagnosis. Her disorder. Dependent personality disorder is when a person has an excessive need to be taken care of and are very submissive towards the ones they love. Schizophrenia affects how a person acts, thinks, and behaves. Psychosis is when a person loses touch with reality. All cultures. I think that the psychological disorders Harley Quinn are diagnosed with is in all cultures because they are heavily based off experiences. They're seen everywhere and in every culture. They just may be seen in different ways. If Harley Quinn went to a therapist in the film, I believe she'd be diagnosed with schizophrenia, fear of abandonment, dependent personality disorder, and psychosis. Stigmas. Being labeled crazy and violent is a stigma of schizophrenia. Clingy and needy comes along with dependent personality disorder, and lack of rejection and insanity comes along with psychosis. Next, we're going to look at the evidence. 2 symptoms. Psychosis is the loss of contact with reality. Hallucinations are delusions. Fear of abandonment is a feeling of fear that someone you love or care about very much will leave you. So then the claims. She's constantly changing her moods. Her sense of reality is distorted, making her see things that aren't really there, such as having a normal life with the Joker, living in the suburbs, and having kids. Even when the Joker is mistreating her, she keeps showing loyalty, doing whatever he says. She jumps into a bucket of chemicals so he doesn't leave her, and when she thinks he's dead, she's completely lost and heartbroken. 1 symptom not shown. A specific symptom that is not directly shown in the film is dependent personality disorder. This is one of the major symptoms shown in fear of abandonment. Harley Quinn's symptoms are more towards the need to be taken care of, the need for constant approval, or the willingness to do whatever it takes to avoid rejection. And then I have a quote from the DSM-V that I used. Next, we're going to look at her treatment. My proposed treatment plan would start with therapeutic relationship building, following trauma-focused therapy, then cognitive behavioral therapy. Lastly, if nothing works, I would monitor her long-term. This is appropriate for this individual because it targets what has brought her harm the most. My ethical concerns would be, there are a few ethical concerns that may come with this treatment, such as dual relationships. Since she was a doctor herself, she'll know more advanced things. And then informed consent is a big one. Since she doesn't really know what's happening, we won't know if she's really okay with this. Her touch with reality is out. 1 situational barrier that may occur is she may end up back in prison or a mental institution where she could lose all of her privacy, which could have messed up the progress. And then we look at our border perception. The portrayal of disorder-dependent personality disorder, PTSD, and psychosis is not accurate in the film. There are parts that are over-exaggerated and showing the better side of the disorder rather than what it really is. Influence of this disorder in the film is influences what we are really thinking. Instead of knowing the reality of this disorders, we are shown the better side of them. It's not changing their function of life that much. We are seeing the quirky side rather than the real painful experience. This is my works cited, and then these are what I used. Thank you.